Patient Zero, Solving the Mysteries of Deadly Epidemics by Marilee Peters. Chapter 5, World versus Virus. Spanish Influenza Pandemic, 1918-1919. Part 2. The second wave hits. For Wade and his small staff, he had just one other full-time doctor working with him and a few clerks and assistants. The task at first seemed overwhelming. Then, before they'd even been able to put together a research strategy, it looked as if their problems might be over. In early summer, the flu suddenly vanished, or seemed to. The hospitals and the Army's infirmary tents were no longer overrun with flu sufferers, and life returned to normal for soldiers and civilians. But it didn't last long. The virus was mutating or changing its form. It was soon to reappear as an even deadlier disease. In a single week that fall, influenza epidemics exploded in 3 cities around the world. In the African city of Freetown, Sierra Leone, in Brest, France, and in Boston, U.S. These 3 outbreaks launched the second wave of the pandemic. Over 6 terrible weeks in the fall and early winter of 1918, tens of millions of people would get sick and millions would die of influenza. All 3 cities were major transport hubs for the military. American troops passing through Brest picked up the virus and distributed it around Europe. Soldiers returning home to North America passed through Boston to board the trains that carried them and the virus to every corner of the continent. Ships on their way between Europe and battlefields in Africa and the Far East stopped in Freetown to take on coal to fuel their engines. And throughout the fall of 1918, they also brought along the influenza virus. A new science for a new century. You're an what? Epidemiologists are used to getting blank looks when they tell people what their job is. In 1918, Dr. Wade Hampton Frost's job description probably left most people scratching their heads. Epidemiology was brand new at the time and almost unknown. In 1918, a group of British doctors and statisticians had formed the London Epidemiological Society to study epidemic diseases in the context of public health. But it took another 30 years before the British government hired their first epidemiologist to oversee public health and investigate disease outbreaks. In North America, things moved even more slowly. It wasn't until 1902 that the U.S. Public Health Service was founded. And it was another 10 years before Harvard University opened the first school of public health in 1913. When Wade Hampton Frost was asked to conduct epidemiological studies on the 1918 influenza epidemic, it was a big step forward for epidemiology. It was also a step into the unknown. No one had ever done a study of the size and scale needed to understand the path of Spanish influenza through the United States. Wade and his small team needed to develop methods for gathering and analyzing vast amounts of data, well before computers existed. Their success helped usher in an era of using epidemiological approaches to fight and prevent some of humanity's most feared diseases. Will this work? There was no cure for Spanish flu, so people turned to folk remedies to protect themselves. garlic, mothballs, sugar lumps topped with kerosene, peels of powdered cinnamon, and eucalyptus oil were all used to try and keep the flu away. Some people thought a potato in your pocket would keep you healthy, while others ate raw onions to repel the germs. Con men sold sacred pebbles, supposedly blessed at a shrine in Japan, to ward off Spanish influenza. You could also try sprinkling sulfur on your shoes or inhaling the smoke from smoldering wet hay. Many people thought that smoking tobacco would ward off infection. One store in Holland made smoking compulsory for its employees. Of course, none of these methods stopped the Spanish flu. In fact, by making people feel that it was safe to go out in public, folk remedies like these may have led to more people catching influenza. The pandemic caused a crisis in many countries because of the wartime shortage of doctors and nurses. In the US, a third of the doctors and nurses in the country were involved in the war effort, and those who remained to care for the civilian population were overworked and undersupplied. Even when a flu victim could find a doctor or an available hospital bed, there wasn't much that could be done to treat the disease. Doctors relied on rest, liquids, and hope to pull patients through. All too often, patients didn't make it. No one had ever seen influenza like this before. Patients could develop any of an array of extreme symptoms: terrible pain, very high fevers, chills, earaches, headaches lasting for days, bleeding from the nose, mouth, ears, and eyes, vomiting of blood and lungs so filled with fluid that patients almost literally drowned. Often before death, patients turned blue from lack of oxygen to the blood, what one doctor described as a dusky, leaden hue. The disease would overtake you so quickly, there were reports of people dropping dead in the streets and of people who went to bed at night healthy and were found in the morning stone dead. There were stories of entire families falling sick and of children left orphaned and alone in homes filled with the dead bodies of their families. Some cities ran out of coffins, so the dead had to be buried in mass graves. Horse-drawn wagons went up and down the streets, the drivers calling for people to bring out their dead. Scenes like these had not been seen since the days of the Black Death, when plague decimated the population of Europe. As this new strain of flu swept the world, wartime media blackouts had to be abandoned. Across the United States, Canada, and Britain, governments and media warned people to protect themselves. Movie theaters, dance halls, libraries, restaurants, and churches, anywhere that people might congregate, were closed. Posters and signs advised people to cover their faces when coughing or sneezing, and many people took to wearing gauze surgical masks over their faces. But nothing, it seemed, could stop or slow down the spread of the disease. In Dublin, Ireland, public health workers poured huge amounts of disinfectant into the street gutters in an attempt to protect the city. New Zealand began to hunt down all the rats in its towns and cities in case they were the culprits in spreading influenza. These and other misguided attempts had absolutely no effect on the pandemic. Tragically, late that fall, the second wave of the pandemic got a huge boost from an unexpected event: the end of the war. When peace was declared at 11 a.m. on November 11, 1918, massive celebrations broke out all over the world. The center cities were jammed with celebrating crowds. Impromptu parades took place. People laughed and shouted and sang, They hugged and kissed and shook hands, and they spread influenza. What's in a name? To Hungarians, the disease was known as the Black Whip. Germans called it Blitzkatar, lightning cold, or flounder's fever. In Poland, it was known as the Bolshevik disease. And in Spain, it was Naples soldier. People in Ceylon named it Bombay fever. The Swiss called it La Coquette, the courtesan. Italians knew it as sandfly fever. To the Japanese, it was wrestler's fever, while in France, it was la grippe, the flu. But if you were British, Canadian, or American, the disease had everyone terrified during the fall of 1980 was the Spanish flu. The names might have been different around the world, but almost all of them had one thing in common. They directed the blame for this dreadful disease at someone else. An influential report. As the second phase of the pandemic started, Dr. Frost and his small research team struggled with a tidal wave of information. Data poured in from locations all over the world where influenza outbreaks were being reported, and there were major inconsistencies in the reports. In some cases, influenza was reported to as a cause of death, while in others, death was attributed to pneumonia. Were those deaths part of the pandemic too? Part of the confusion came from the fact that the U.S. doctors treating influenza patients in 1918 were not required to report the cases to the local board of health. Influenza, up until then, had not been considered a disease that the public health service needed to track. Unlike diseases such as smallpox, typhoid, or cholera, which they were very concerned about and kept close tabs on. Who had needed to track the number of cases of flu, which was usually a mild 3-day illness? For Wade Frost and his team, this lack of information presented a major difficulty. How could they determine how widespread the disease was or how lethal it was without knowing how many cases there were? The only answer was shoe leather epidemiology, going house to house, knocking on doors, asking how many in each home had suffered the flu and how many had died. It was the same technique that John Snow had used in London during the 1854 cholera outbreak. Wade had conducted shoe leather surveys himself in New York while investigating a polio outbreak there in 1916. But how could one small office survey an entire country, much less the entire world, to track the course of a pandemic? In the end, Wade knew he could only hope to survey a tiny sample. He and his team chose 10 cities, then trained hundreds of canvassers who they sent out to interview the inhabitants. Over the spring of 1919, the surveyors talked to 112,958 people, asking them in detail about their experiences during the Spanish flu pandemic. Had they gotten sick? Did they know anyone, a friend or neighbor or family member, who had come down with influenza? How long were they sick for? What were their symptoms? It's a mutant. Influenza is a master of disguise and very changeable. We can develop vaccines to protect us based on the versions of the virus we already know and predict might be heading our way again. But every time a new strain of the flu emerges, our immune system fails to recognize it, and new flu vaccines have to be formulated. Scientists call these changes to the virus mutations. And thanks to these ongoing mutations, We get sick with flu year after year. Influenza viruses can mutate in two ways, through either antigenic drift or antigenic shift. An antigen is any substance like a toxin or a virus that causes an immune response in the body. Antigenic drift is a process of gradual change in which the virus changes bit by bit. Antigenic shift is fast and causes big changes. Scientists speculate that antigenic shift caused the Spanish influenza virus to turn lethal in the fall of 1918. In August 1919, Wade published his report on the pandemic called The Epidemiology of Influenza. It contained two important discoveries that are still studied by epidemiologists. First of all, the report noted that before anyone was aware of the influenza epidemic, there had been a rise in the number of reported deaths from pneumonia. Since pneumonia is a lung infection that can result from influenza, an increase in pneumonia is one of the early warning signs of an epidemic that public health agencies still look for today. The report also demonstrated that influenza was a particularly lethal killer of the very old and very young, which is why flu vaccinations are now given to people over age 60 and under 5. The 1918 influenza pandemic also killed an unexpectedly high number of healthy young people, and its path to destruction came to be known as the lethal W, because charts of the death rate show an alarming bump in the middle. Why did Spanish influenza kill so many people who were in the prime of their life? It's a riddle that has continued to fascinate medical researchers. Scientists now estimate that a similar strain of flu had not appeared for at least 70 years before the 1918 pandemic, so almost no one had any immunity to Spanish flu. That meant that many more young adults came down with Spanish flu than could be expected in a normal flu outbreak. But this was no normal flu. Either it was deadly. Some researchers believe that the Spanish influenza virus triggered an overreaction in its victims' immune systems. The strong immune systems of healthy young people were turned into killing machines by the virus, causing such extreme symptoms that the sufferers eventually died. How many died? We'll never know exactly how many people caught Spanish flu and how many died of the disease. Epidemiologists estimate that the death toll may range anywhere from 50 to 100 million. That's a big range. Between 16 and 18 million people may have died in India alone. Spanish flu also came hard on the heels of a plague epidemic that killed 12 million people from India between 1898 and 1918. While there are no statistics available for countries in Africa, estimates place the number of deaths in the tens of millions. There are also no reliable statistics for the death tolls in Southeast Asia, China, or South America. In Canada, 50,000 people died from Spanish flu, while in the U.S. there were 550,000 deaths. In Britain, 228,000 people died. In Germany, 400,000, and in France, 300,000. Tools of the trade, finding patient zero. Wade Hampton Frost made one of his biggest contributions to epidemiology long after the Spanish flu pandemic. In the 1930s, Wade was investigating abnormally high rates of tuberculosis in the U.S. state of Tennessee. Tuberculosis is an infectious lung disease that kills millions of people worldwide every year. As he pored over the records of cases, Wade realized that when an outbreak could be traced back to a single individual, the full pattern of the outbreak could be reconstructed. Finding this person would allow epidemiologists to determine how the disease was spreading, how contagious it was, and what made people vulnerable to the disease. He called that person at the center of the outbreak the index case. Epidemiologists still use the term, as well as techniques that Wade developed to identify the index case. Today, we sometimes also call the first person to get a disease patient zero, a term that became popular after it was used in a book about the spread of AIDS in the US.